Hello, everybody. I am Dr. Shyam Sankar Varma. I'm a consultant nephrologist, and I'm just creating a patient care awareness video regarding edema. Now, what is edema? Edema is nothing but swelling. Any swelling anywhere is called edema. And this is nothing but fluid trapped in the spaces that surround the body's tissues and organs. Now, something regarding edema. This can occur anywhere in the body. And if it is generalized edema, it is called as anasarca. Anasarca meaning, ana meaning throughout, and sarca meaning flesh, that is edema throughout the body. As you can see in the picture here, edema, this patient has got generalized edema, or also called as anasarca. It can happen anywhere in the body. If it happens in the lower limbs or hands, it is called as peripheral edema, as you can see in the picture here. If it occurs in the abdomen, it is called as ascites. And if it occurs in the chest, if it's in the lungs, it's called as pulmonary edema. And if it is in the space surrounding the lungs, it is called as a pleural effusion. Something regarding the symptoms. What are the common symptoms of a patient with edema? It depends upon the cause. And there's usually swelling or puffiness. And this can happen over the face. It's called facial puffiness. It can happen anywhere in the body. And the skin is stretched and shiny. And it is usually worse in the dependent areas of the body. It is called as dependent edema. And those that are closest to the ground because of the gravity, there is edema, and this is called as dependent edema. And where does this appear? This appears in the lower limbs in a patient who is walking about, standing, sitting, and it usually occurs by the end of the day. And if it occurs in the lower back, it is called as sacral edema, and the face in a patient who is lying down all the time. And early morning facial puffiness is a sign of kidney disease. As you can see in the picture here, this is a picture showing us a patient with sacral edema. What are the signs now? Pressing on the swollen area of the skin for a few seconds will leave a temporary dimple or a dent in the skin, also called as pitting edema, as you can see in the picture here. And the other signs are weight gain, increased size of the abdomen in a patient with ascites, and difficulty in breathing if there is a fluid collection in the lungs. Now, what are the common conditions associated with edema? The most important cause that we are dealing with here is kidney disease. Here, the patient will have swelling in the lower legs, around the eyes, and also shortness of breath. The common causes are nephrotic syndrome, where there's a tremendous loss of protein in the urine, and hypoproteinemia, or loss of protein in the urine, or decreased protein in the blood, results in edema in this case. And the second cause is chronic kidney disease, where you have a slowly worsening kidney disease over a period of 3 months or so, resulting in edema. The next common cause is heart failure, also called as congestive heart failure. This is because of a weakened heart and impaired pumping action of the heart. This results in swelling in the legs and abdomen and shortness of breath. Now, what are the other causes? The other causes, of course, less common, are chronic venous disease because of poor quality of veins in the legs, deep vein thrombosis, where there's a clot in the legs, in the veins of the lower limbs, pregnancy, because pregnant women retain extra fluid, and one important cause is drugs. This can occur as a side effect of a variety of medications, the most important of which oral diabetic medications, example of which is pioglitazone, then high blood pressure medications, for example, amlodipine, the calcium channel blocker, and over-the-counter pain relievers such as diclofenac and ibuprofen. And of course, estrogens in a patient who is receiving a hormone replacement therapy. And the other common cause is chronic liver disease, cirrhosis liver. Then in a patient who is traveling for a prolonged period, sitting for prolonged periods, such as during air travel, and as a result of allergic reaction to drugs, it is called as angioedema. And whenever there's a lymphatic obstruction, this is known as lymphedema. Now, how do you treat edema? Most important thing is treatment of the underlying cause. And then the most important thing is restriction of salt as well as fluid, reducing the amount of salt in your diet, using compression stockings, especially in people with venous incompetence in the limbs, lower limbs, and elevating the lower limbs can help relieve edema to a certain extent. If it is not relieved by these measures, of course, you have to go for medications, most important of which is diuretics. These are medications that cause the kidneys to excrete more water and more sodium. Any substance that promotes diuresis, that is increased production of urine, is called as a diuretic. Sometimes it is colloquially called as a water tablet. This diuretic helps in a state of whenever you have a fluid overload related edema. Every medication is not without side effects. The most common cause is you pass a lot of urine. Peeing more than usual is one common adverse effect. Other adverse effects are dizziness, tiredness, headache, and of course you'll have a low potassium unless you're taking a potassium sparing type of diuretic. And muscle cramps are another common adverse effect. The most important diuretic that we'll be dealing here is torsemide. Torsemide is used to treat fluid retention and swelling that is caused by congestive heart failure, liver disease, as well as kidney disease. And it belongs to the class of diuretic called as a loop diuretic. The most potent among the loop diuretics, of course, torsemide. The other diuretics that belong to this category is furosemide, which is commonly called as Lasix. The take-home message here is edema is nothing but swelling and mostly indicative of fluid overload. The life-threatening causes for edema is the kidney failure, heart failure, as well as liver failure. And treatment, of course, is salt and water restriction. And medication that is used to treat is, of course, a diuretic. Thank you all. This is just a patient awareness video regarding edema.